The purpose of this video is to cover the basics of the human skeletal system as would be needed for a beginning high school forensics science student studying the forensic anthropology chapter in a basic forensics course. This video by no means would be suitable to help a human anatomy and physiology student study the skeletal system. It is just meant to help aid an individual who has not had anatomy and physiology to begin their unit on forensic anthropology and just get a background of information for the skeletal system. Now, forensic anthropology deals with the identification of skeletal remains that are so badly decomposed that otherwise an individual would be unable to be identified. Now, these human remains are going to be important both legally and from a humanitarian approach, and a forensic anthropologist will use all of the clues that will be left by the bones in order to sort out and pull out the identity of an individual. This information can help lead to identifying a lost loved one. It can help us to determine the age, sex, race of an individual, along with any special conditions that may have been met while the person was alive. Now, as we begin, the skeletal system is composed of cartilage and bone, and by using the characteristics of the cartilage and bone, we will be able to tease out information about the skeletal remains in hopes of identifying the unknown skeleton, not only who the skeleton belonged to, but also any damage that occurred to the skeleton, and so that we can piece together the events that led to the individual winding up in this particular circumstance. So the function of the skeletal system includes supporting the soft tissue and protecting the delicate organs that lie below the bones for various types of movement, and as a storage area. Storage for calcium, phosphorus, fats, various other minerals. Also for blood cell formation, also known as hemopoiesis. Now, the specific area of the skeletal system that will be addressed on this video will include teaching the difference between the axial and the appendicular skeleton, helping the student to identify the hyoid bone. And the hyoid bone is a bone that we'll show you in a slide or two away. But when this bone is crushed, it is a good indication that some kind of strangulation occurred. We'll teach you about the fontanelles and help you learn to identify the various types of vertebrae. We'll also show you the types of fractures that you may run across, as well as learning to differentiate between race, sex of an individual, height, and a few other components of the skeletal system. Now, the human skeletal system is composed of 206 bones, and we can take the skeletal system and divide it into two parts. The axial skeleton, which will form the midline of the skeleton. We'll show you a picture of that in a moment. And 80 of the 206 bones will lie within the axial skeleton. Of these 80, 28 will be found in the skull alone. The appendicular skeleton will be the remaining 126 bones and will be found in the arms, the legs, the pectoral, which is going to be the shoulder area, and the pelvic girdle, which would be the hip area. So here we have a diagram differentiating the axial versus the appendicular skeleton. And all of the skeleton that you see in green would be indicative of the axial skeleton. Again, 80 of the 206 bones lie here. The yellow portion of the skeleton would be the remaining 126 bones forming the appendicular skeleton. Here we have just another slide showing you the difference between the axial skeleton and the appendicular. Again, the axial skeleton is in the green while the appendicular is in the yellow. And we have some of the bones labeled for you so you can see the bones associated with each, the axial and the appendicular skeleton. Here we have the vertebrae column, which is a part of the axial skeleton. Now the vertebrae column right here is composed of various types of vertebrae. If you take a human anatomy and physiology course, we will teach you how to differentiate these. However, the first 7 vertebrae of the body are the vertebrae that's found in the neck region, and these are known as the cervical vertebrae. These right here that are outlined in purple are the vertebrae where the ribs are attached. There are 12 of these, and these are known as the thoracic vertebrae. Our lower back is composed of the lumbar vertebrae, and there are 5 of these. Our tailbone is composed of the sacrum, which has 5 fused bones, and the coccyx, which is known as the tailbone, and that has 4 fused bones. And if you've heard of someone that has broken their tailbone, they have broken the coccyx right across here off of the sacrum. Now you'll notice that we have the neck raised, and just underneath the chin area we have this bone right here. This is known as the hyoid bone. This is the only bone that does not come directly in contact with any other bone of the body. We do have various muscles that do attach to the hyoid bone, including muscles that lead up to the tongue. If this bone right here is crushed, and we have an examination of a body and they find this crushed, this is going to be indicative of some kind of strangulation occurring. Now here we have some various diagrams of fetal skulls, and one of the things we want to show you is these areas right along here. And these areas right here are known as fontanelles. These are areas where the skull bones have not fused together yet. We call these the soft spots on the baby. And so these are open to allow for growth of the brain, and as the brain grows and reaches a more mature size, these fontanelles will begin to close. We can use these outlines, which will be known as sutures, and the opening of the fontanelles and the sutures to help to determine the age of unknown skeletal remains. So when one finds badly decomposed bones, it's not uncommon to find bones that have fractures or possibly even healed fractures. So some of the types of fractures you may run across would be a simple fracture, and this is just a simple clear break. A compound fracture is one where the bone has not only broken but has pierced the skin and is sticking outside of the skin. A green stick is an incomplete break. This is typically because we have more cartilage present, and you'll find green sticks more common in young children where the bone has not completely ossified. On the other hand, the comminative is where we've had the bone that has shattered. Now, an individual that has survived a comminative break, and it's very common to do so, these are typically elderly individuals or individuals that have gotten older, such as the dad who still thinks that they are 14 and can play football, and they get out and play football and break an arm. So here we have it shattered, and these individuals would need some kind of plate put in to help reestablish the bone. An impacted bone is just that, where the bone has been pushed up into the broken area. And so these are just a few of the types of breaks that you would run across. Additionally, other skeletal information that can be very useful is looking at the pelvic area to differentiate between a male and a female pelvis. Now, the female pelvis typically is heavier and has rougher bones, and then the cavity of the male pelvis tends to be smaller than the female. The male pelvis also is more narrow and deep. However, it's going to be this pubic arch that will be the easiest way for a student to differentiate between a male and a female pelvis. The pubic arch is greater than 90 degrees in a female and less than 90 degrees in a male. So here we have two pelvic bones represented, one being a male, the other being a female. Again, we can look at the width of the pelvic bone, or we can look at the width right here. This right here is the ischial spine, and how wide we have the ischial spine. But the easiest way to differentiate the male from the female is to look at that pubic arch, which is right here. Now, when the pubic arch is less than 90 degrees, this indicates a male. When this pubic arch is greater than 90 degrees, this indicates a female. And that's the easiest way to differentiate a male pelvis from a female pelvis. We can also determine age within a given range by looking at the development of the bones. And so an individual's age at the time of death can be determined, give or take a few years, by looking at skeletal remains. The most accurate bones for determining or estimating skeletal age would be teeth, the growth plates, also known as the epiphyses, the pubic symphysis, and the cranial sutures. Now, I will talk to you about the teeth and the cranial sutures being some of the easiest bones to work with in a beginning class. But investigators will always use an age range because of the variation between people and how they age. So we will have an age range set up, a certain age, plus or minus so many years. If we were to use the growth plates, we would have to look at male versus female, and then we would look at, do we have any separation of the epiphyseal plates? If we have separation, this does still show that we have growth occurring. And so on males, it would be 21 or younger. Females, we would be looking at 20 or younger. Now, as we look at this, if we look at further separation, we can even estimate the age as being younger. If we have partial separation, you'll notice that the age range becomes a larger gap. And if we have a complete union, this will just tell us that we have someone that is over 20 or 21 years of age. Now, right along here we have the sutures, and this is a sagittal suture, and the sutures become completely closed in males by age 26 and females around 29. So if we see this completely closed and we've identified this as a male, we can estimate that the male is 26 years or older, and with the female 29 years or older. Now, if this right here is open, we can estimate that the male is less than 32 and the female is less than 35. If it is completely closed and almost absent, the male is over age 35 and the female is over age 50. And this can, with bone remodeling, become so reattached that it's almost invisible. And that would be indicative of an older individual. Now here I've got a 5-year-old child versus a neonatal child, and you can see the difference in the bones, and you can see right here where we have the bones not quite fused together. Notice right here on this 5-year-old child how large the brain cavity is, and this is because we still need room for the brain to continue to grow. Also, notice on this 5-year-old child how clear we have that sagittal suture and that we still have openings in between here. If we compare this to an individual who is over 60, you can see that this suture right here is clearly visible, where here in an individual over 60 it's almost gone. Now we can also see here wearing on the bones, and we can just see that the bones are more well formed. Now this right here, the loss of the teeth, could be due to aging. It could also be due to the condition in which the bones were found. So do be careful by making assumptions because teeth are missing. Now when you begin to determine age based on teeth, you always want to begin counting the teeth at the front of the mouth as opposed to the back. If you start counting the teeth at the back, you are making an assumption that their wisdom teeth have come in, and they may not have. But if we start at the front, then we can count back and determine whether or not wisdom teeth have erupted or not. So we can have examples. Here we have an individual that's between ages 18 to 23, and here we would have an individual that's ages 60 to 70. Now, with this individual here, we can see the first two molars are in, but we have a molar 3 just starting to erupt here. That would be the wisdom tooth. And then right here, we're seeing that that sagittal suture is almost gone, indicating that if this is a male or female, we're looking at someone over the age of 50, so pushing 60 to 70 years old. Additional bones right here that are showing the development of an individual ages 60 to 70. Now this one right here, we can see that is due to age and tooth loss, and here we can see osteoporosis present in the bone. So by examining the bone, we can tell if the individual is elderly, possibly can tell if the loss of teeth was before death or after, and then we can determine if the individual had any kind of bone disease. And so here we can clearly see osteoporosis. Sometimes we may also see a calcium buildup on the vertebrae, and that would indicate the person walked hunched over and was not able to stand up straight. Now when we determine sex of an individual, here we have a male versus a female. One of the first things we want to notice is the squareness right here of the jaw, and that's very characteristic of a male versus a female that has a more rounded jaw area. The cheekbones here are going to be a little bit more pronounced for larger muscle attachments than we would find on the female. We would also have a more robust appearance of a skeleton or a skull on a male versus a female. It's going to be a much softer appearance. Racial characteristics can also be used to help to identify an individual and get the remains back to a loved one. Now, we would have to say that ancestry could be determined if an individual is transracial, and they may have characteristics of more than one race, but it does help lead to more details of helping to identify the individual. So with a Caucasian, they will have a long, narrow nasal area. They'll have a triangular palate, which would be the roof of the mouth. Narrow zygomatic arch, which is the cheekbones. An African American would have a wider nasal area. Their roof of their mouth is going to be more rectangular. We may see more of a square eye orbit, more pronounced zygomatic arch or cheekbones. When we look at Asians, they're going to have a more rounded nasal area. They're going to have more rounded orbitals where the eye sockets would be. They'll have a wider zygomatic arch or cheekbones. So let's look at some examples of these skeletons. Now here we have an African American. We've got that wider area here between our eye sockets. Also notice how the eye sockets are more of a rectangular shape. Also, you can look right there and you can see that guttered nasal border. Now this one is an American Indian. You'll notice that right here, this is not nearly as rectangular as we see on the African American. It's much more rounded. You'll see an angular zygomatic arch, which is our cheekbone area, and a little bit more of a flared nasal base than we would see in our African American. With the Caucasian, one of the things we notice with the Caucasian is this prominent nasal spine, and this right here was very helpful in identifying Caucasians. They also will have a much steeper nasal area. The eye socket orbit is more sloped and more of an S-shaped zygomatic arch as far as when we look at our sutures in this area. Another characteristic we would see, this being an eye socket, this right here being the bridge of the nose, is that we see this metotopic suture right here, and this is generally a trait that we would see on Caucasians. And just to show you, when we find skeletal remains, you may find that they have dentures. You may find that there's a healed fracture where there was once a break. You may find that the individual had some kind of periodontal disease, or we can look and determine that they would have arthritis. So a lot of information can be gained by examining the skeletal remains of an individual. On this slide, you can see the different types of gunshot wounds. Remember that the entrance wound is always much smaller than the exit wound, but just a few examples of different appearances of gunshot wounds on the skull. One also has to keep in mind that the skeletal remains may have been chewed on or damaged due to carnivores. Because of that bone marrow inside of the bone, many times you will have wild animals that will chew into the bone to get to that bone marrow. And so right in here we can see that the teeth can leave different types of marks on the bone, and those are just two examples of marks that are left by some kind of canine tooth as the canine was working towards reaching that bone marrow. Right here we can see the ball and socket of an individual that had a strenuous activity, and we can see that that head of that humerus area right here is almost completely worn down, and so this would be a good indication of someone that did a lot of heavy manual labor during their lifespan. Now, one of the most important things that you can do is to sit and study and learn these basic bones on the skeletal system. And if you take an anatomy class, you'll learn that there are a lot more details on the skeletal system than this. But let's just review over a few. When we're looking at our lower arm, remember that the radius is always the bone on the thumb side. The ulna is on the other side. When we are looking at our hip area, this top part is the ilium, the back area is the ischium, and the front is the pubis. When we look at the lower leg, the larger is the tibia, the smaller is the fibula. You tell a little lie, you tell a little fib. The toes and fingers are both called the phalanges. The wrist bones are called the carpals, and then the first part of the hand bones right in here are called the metacarpals. Down here, our ankle bones are called the tarsals, and then the top foot bones right in here are the metatarsals, with the toes being the phalanges. Do study over the skeleton and learn these basic bones. And here we have just one more skeleton, just a different view for you. Again, the patella is the kneecap, the upper arm bone is the humerus, the leg bone, longest bone of the body, that is the femur. You can see the sternum, it's made up of 3 parts, and we're not going to ask you to know those parts yet. The clavicle is the collarbone, the shoulder blade, which is on the back, is the scapula, but do study these and learn these bones for your upcoming quiz. Again, if you were to take an anatomy class, you would be expected to know all of these bones, but a few things. The jawbone right here is the mandible. Right here we have the maxillae, which is the upper jaw. The zygomatic bone is the cheekbone. The front part is the frontal. This would be important if an individual received a gunshot wound. What bones were destroyed? what bones did we have the entrance wound on, and what bones did we have affected by the exit wound. So do review over the list of skeletal bones that you were given in lecture to know for your upcoming test. And again, remember that this is an extremely basic review over the skeletal system, just to help a forensic student who has not had human anatomy and physiology yet. This video is by no means meant to help with a human anatomy and physiology skeletal unit.